Your dentist is asking you to get a bridge done. Now, what bridge is he talking about in your oral cavity? Hi everyone, welcome back to my channel. I'm sure that most of you, if not for yourself, but you would have definitely heard it for your relatives or your friends, that their dentist asked them to get a bridge done. Now you must be wondering, why is dentist asking you to get a bridge done? And a bridge, how is it even related to dentistry? Yes, so the dentist is asking you something which is just called a bridge, but it's in your mouth. That's it, that's the difference. Now what is a bridge? A bridge will be something which connects two surfaces, like two areas, right? So whenever there is a missing tooth, like if there's one tooth missing in a place and you need to replace that, do you think it's possible to take a single tooth and just fix it there? Like even if it's an artificial one, you cannot glue the tooth surface onto your gums just like that. It's not going to stay there. So a bridge is something which is actually used in order to replace the tooth surface, the tooth that is missing. And it's been an age-old practice. It's not something new, as well as this has been one of the gold standard treatment in case of a missing tooth. Of course, there have been various other treatments that have come up after that, and they are also good enough. But a bridge is something which has been done from years and ages, and it has given very good result, and that's one of the commonest thing which most of the patients will go for. So let's see what is a bridge in the mouth. So imagine that you have a missing premolar. So you want to replace the tooth. So what the dentist will advise you to do is that you need to take the support from either sides. Like imagine that there is something missing in the center and there is a good tooth here and there is a good tooth here. Sometimes you need one more tooth. So the dentist is going to take the support from these adjacent tooth in order to replace the missing tooth. So the structure which is formed looks like something which is going to bridge the gap between these two. So whenever there is a missing tooth, the tooth that is got from the lab, you cannot just stick it over there. So you need to have a cover here and you need to have a cover here in order to keep it like that. So that is what is called a bridge. A bridge which has three tooth is called as a 3-unit bridge. Sometimes you might have a 4-unit bridge or a 5-unit bridge. A very long span of bridge is generally not given. But of course, a 3 to 5 is something which is very common. So you already know, you might have seen that the root canal, after the root canal, you put a crown or a cap. Now, the cap is something which is like an artificial tooth thing, which is like a cap on the surface of the tooth. Similar to that, you will have two caps on the adjacent tooth surfaces, and you will have a full-grown tooth, this big a tooth, onto the missing place. If you actually go through the pictures that I'm putting up, you can see how it actually looks like. So, to do that, what is your dentist going to tell? He or she is going to advise you that the adjacent tooth which is needed will have to be prepared before having a measurement taken for replacing your tooth. So, what is the preparation of the adjacent tooth? See, the tooth, everything in the mouth is balanced. You cannot take something from outside and just put it there. If there's a missing tooth, yes, that can be replaced. But when there is a good tooth structure on either side, on top of that, you cannot place something. So the preparation of the tooth, they mean that you need to do some adjustments on the adjacent tooth surface in order to receive what is being fabricated in the lab. So the preparation of the adjacent tooth structures is something like you trim it and make it slightly smaller than how it is supposed to be, and then you take a measurement which is then converted into a mold, and the mold goes to the lab and your crown or the bridge and is going to come from there is fabricated. The fabricated bridge is going to be cemented onto your tooth surface. So you can actually imagine that there is something like this on either side and there is a tooth in the center. So it comes from the lab. You have certain cements which will act like a glue, which is applied onto these tooth structures, and then they are placed onto the adjacent tooth sides. So it will look like it's a bridge. You will have the missing tooth as well as you will have two cap-like structures on the adjacent tooth surface, but it will look all natural. So the preparation is just done so that this extra thing can be accommodated into the oral cavity. Now, some of the dentists will advise you to get a root canal done on the adjacent tooth. Now, whether it is right or wrong, it is quite debatable. It totally depends on the condition of your tooth and your dentist and his treatment protocol. So in some conditions, you need to just not prepare the adjacent tooth. You will also have to get a root canal treatment done in case the tooth is already having a decay which is large, or it is having a lot of attrition, that is loss of enamel. In that cases and all, root canal is advocated before putting this bridge, so that after some time the patient should not have a problem. If there is a problem later on, treating through this bridge becomes slightly more difficult, as well as it is always better that if there is a problem that can occur, it is better to prevent that. So in those cases, the dentist is going to advise you to get a root canal done on the adjacent tooth. But otherwise, if you have a very healthy tooth structure and there's no requirement for it, definitely your dentist is not going to tell you to get a root canal done on either teeth and then have a bridge. So I hope that a bridge, when a dentist says you to get it done, I hope that you understood what it exactly means. And please don't worry, getting a bridge done is one of the commonest thing, and if it's done in a very good way, it lasts almost 10 years. Most of the labs do give a guarantee, but it's not just about the lab. Otherwise also functionally, having a bridge is very useful and it's not at all troublesome. Maybe in the initial 1 or 2 days you might take a little bit time to get used to it, because you are having a missing space there, right? A missing tooth will be having a missing space. You are used to that. Then if there's a long gap before having the missing tooth and then putting a bridge, then you might actually have a little bit trouble in the beginning. Just couple of days you will get used to it, but aesthetically it will look same color as your natural tooth structure. There is shade selection which is done, so it will actually look like how you had a natural teeth. There will be absolutely no difference in that, and functionally definitely it's going to be useful. You can chew on that side. Getting a bridge done is not something major. Get it done from a good lab. I'm sure that the dentist that you are going to will actually recommend a good lab for you to get it done. They are going to cement it well. Only thing that you need to take care is that after the bridge is done, do get a checkup once in 6 months to 1 year. Get the area cleaned, keep it maintained clean even in your house, because what goes under the bridge we do not know. The food particles, this tiny food particles may go inside and cause a decay underneath, which needs to be avoided, because of which you need to have a good taking care pattern on a daily basis. Do brush, floss if you can, and keep them healthy. Thank you.